Throughout the years, I would give patients different hints on what to do as far as activities of daily living. These are helpful hints regarding anything from how to lift, to using heat and ice, to just anything regarding everyday activities. I'm going to begin with the first, which is going to be the heat and ice protocol. Ask yourself, when do you use heat and when do you use ice? Now, it's very confusing at times, so I'm going to go ahead and clear that up for you today. Heat is good for varispasm muscles. Now, ice is good for things that are inflamed. For example, like you have an irritated nerve root and it's inflamed or hot. You'll feel pain radiating down into your arm. Or let's say it's an acute injury. It's within the first 24 to 48 hours. That's when things are going to be inflamed as well. That's when ice is really good. If you do have a muscle spasm, that's when heat is good. Now, moist heat is best, because dry heat over a prolonged period of time will actually dehydrate the muscle, and when it dehydrates, it could spasm. So moist heat is always best. Now, if you have both issues, say you had a spasm muscle, but you also had an inflamed nerve root, what do you do then? Do you use heat or do you use ice? Well, the truth of the matter is you actually use both, heat and ice. But you need to do it in a very specific method. You want to do 20 minutes of heat, followed by 20 minutes of cold, and then 20 minutes of rest. Now, the reason why you go in this particular order is because if you go cold, and then heat, and then rest, during that last 40-minute period, you're going to re-inflame the nerve root. So you go 20 minutes of heat to calm down the muscle, 20 minutes of cold to calm down the inflammation, and then you rest for 20 minutes. That's how you use the heat and ice protocol.